Artificial intelligence has been helping to save lives when used in the medical fraternity. And for the first time, Medanta Hospital has introduced this technology. It's called Penumbra Flash, wherein you can easily, through a non-invasive surgery, remove multiple blood clots when a patient presents such a problem. And we know the rising amount of sudden heart attacks in India are a very, very big concern for us. I am with Dr. Naresh Trehan, the chairman of Medanta Hospital. And sir, firstly, I just want to ask you, how is this technology changing lives for the people through the use of AI?
So if you first understand what happened to our captain here, he has been by traveling 2 hours in his car both ways, and then also sitting on the simulator for hours. When he got up, he suddenly felt short of breath. So he was taken to some hospital close by, and then he was not satisfied because he was continuing to have that, and we brought him here. And the team, consisting of Dr. Kasliwal, Dr. Parakh and Dr. Grover, Dr. Kasliwal first did the echo and recognized that he had thrown clots from his legs into his lungs. And that's what happens. It chokes the arteries and the oxygen cannot exchange in the lungs. So this becomes an emergency. Right. And it was. In the past, what we would have to do is we had to have to do an operation, open the arteries of the lung and then suck out all the clot. So it was quite a major operation with its own consequent comorbidities and all that. So, and also the risk. So with the recently introduced technology, which is AI-based, which Dr. Grover can explain to you better, that you can actually, instead of opening the chest and the arteries, you can actually suck out these clots with the help of this flash, Penumbra Flash, where AI comes in very sort of critically in the whole process, because it actually helps to do the right thing as far as sucking the clots without sucking blood, which Dr. Grover can explain to you more. But more importantly, the diagnosis was very important. So immediately when he came in and they did the echo, they recognized that the arteries going to the lungs are all distended and choked. So please, Ravi, if you can just explain the process.
Sure, sir.
So when he came in here, after taking a detailed history, we did an electrocardiogram. The electrocardiogram did not reveal much, but we had taken a blood sample. So as is the thing here is that we did an echocardiogram. And on the echocardiogram, we found that the right side of the heart, RV and RA, as we said, were dilated. And while we were screening, we saw a clot in the main artery of the lung. This is called the main pulmonary artery. And then it divides into right and left. So that's where we got the hint that he has first to go to the CTPA room to define what he has. At that time, he continued to be breathless and he continued to have increased heart rate. So that echo came as very handy at that moment in actually showing the right direction for the diagnosis. Right. Otherwise, he may have landed up in the cardiac cath lab, because such patients have cardiac lesions and they have to have an urgent angioplasty. But here the situation was entirely different. So that was, and again, echocardiography is totally, there is no radiation. It is a painless procedure. In 15 minutes time, we knew what route we had to take. Right. And then we went to the CTPA room.
All right. Doctor, why don't you also tell me that how interesting this particular surgery was, because the patient was completely aware of what's going on.
Yeah, so at this instance, I would take the opportunity to first of all thank Dr. Train, because last month we launched a team called PERT, which is Pulmonary Embolism Intervention Response Team. Because in such cases, the most important thing is the timely intervention, as Sir said, because if someone is not able to breathe, then it becomes a problem. So initially we would have opened the chest and removed the clots. With this technology, like everything has become minimally invasive. So you don't need to make any incision. Right. which means just through a needle hole, you introduce a catheter. So this catheter basically sucks out all the clots. As mentioned before, the AI assists you in such a way that it only sucks the clots, it doesn't remove any blood. The moment the blood starts coming from the catheter, the machine stops automatically. And that's the indication that, okay, all the clots have been retrieved. And we will share the images of the pulmonary angiogram as well as the clots which were retrieved. So you could see all the parameters like the pulse rate, the oxygenation, the ECG, everything improving simultaneously on the monitor. So it's not that something would take time. So I think total time duration was less than 15 minutes for the whole procedure.
Wow, and I also want to speak to the very fortunate patient who's been the first one to be operated through this particular procedure, Mr. Narendra sir. So, what was your experience? Because I've been told by this team of doctors that you were awake during this procedure.
To be very honest, I didn't know how serious it was till I was taken for the surgery, and it's a very informal kind of atmosphere. While the surgery was going on, I was watching it on monitor. And the three of the doctors were there, Dr. Parekh, Dr. Tarun, and Dr. Virendra. We were all having a good chit-chat, frankly speaking, at that time. They were explaining to me what's happening. So I came to know how serious it was only when at the end of it, they showed me the picture of the clots. Then I realized, oh God, what I was carrying in it. So
Initially when you came in, what were you experiencing physically?
see, this was kind of a sudden onset of breathlessness with no other complaints. So because the breathlessness was there, I just at home I used that BP monitor. That shows me it's not only breathlessness, it's also what we call tachycardia because the heart rate was racing past 120. And my brother-in-law happens to be a doctor. So when I called him up, he said, you better go to the hospital and get your ECG, etc. done. So I went to a close-by hospital. So there they done that, and when they did other tests, blood tests, etc., for heart enzymes were quite elevated, and they also advised that I will have to have an angio. They'd also done a chest X-ray, and they said you'll probably need a CT scan also. But I was very keen to come to Medanta, so in fact I had to leave that place.
So there they already told you that you must go through an angio.
In fact, they told me if you wish to leave, please head straight to the other hospital. If you want to go to Medanta, don't go home. But by this time it was a little late at night, so I went home, had a good sleep, and came back because, as I mentioned, I didn't really know
How serious this was.
It was till the next day when we went through this and realized it. So thankful to this wonderful technology and wonderful team of surgeons and the very, very experienced Dr. Kesliwal.
Of course, and for all the patients or all the people who experience shortness of breath, must always consult their doctors because you never know how serious it could be. So, and what would be your message also to people who could be experiencing something like this?
So as you know, in the recent past, we are seeing more and more people collapse suddenly. And that just means that the warning signs have been missed or preventive checkups have not been done. In the case of our captain, this is something that he wouldn't know, nobody would know, till the shortness of breath happened. Now, you could take it lightly and say, I'm going to lie down and maybe feel it's not so bad and it'll go away because that's wishful thinking. But it only underscores the point that even minor, what you think is minor can be life-threatening. Because if this hadn't been done, and more clots would go up, and they'll choke the whole system. This is what happens. Sudden collapse is very well documented from these clots going into the lungs. So I think it just gives the message that when something like this is out of kind of your usual feeling, please do not take it lightly, because it can lead to a consequence of collapse, death, whatever. And that's why I think a preventive checkup is good. And also, if this kind of thing happens, immediately report to a doctor or a decent institution where you can be diagnosed right away.
Of course, and Medanta is the only hospital that's using this technology at the moment, and of course, it would take others a lot of time to bring this in. But certainly, a non-invasive, minimal invasive, technique that would save the patient's life is path-breaking, and definitely one must be careful of these kind of symptoms. If one notices, one must contact their doctors. And as we are witnessing, there's a rise in the number of heart attack cases and sudden collapse cases in India. It's very important to take care of your health. And of course, Mr. Narendra here has been able to get better in just 48 hours, and that's way longer that, it would take you if you had gone through an angiography, an angio and an operation there. So, which is why it's really important to see how artificial intelligence is actually changing lives of patients and making it much better and much faster to recover as well. With Alok Das, Milan Sharma for India Today.